Welcome to Wellness Wisdom. Being a board-certified family medicine physician, I treat patients of all ages. But I've noticed a disturbing trend amongst my young patients where they have some significant misconceptions about their health that I want to debunk right now. Let's get started. Young people rely on urgent care far too often, and that's not to say that there's an inherent problem with urgent cares. They're actually a valuable tool that we use in the healthcare system to decrease the strain that's been put on emergency rooms. However, receiving urgent care is not the same thing as receiving primary care. Because when you develop a relationship with a primary care physician, you see them over the course of your life through multiple visits. That establishes something that's known as continuity of care, where the doctor gets to know you, gets to know your symptoms, what's normal, what's not, what medications you prefer. Do you even prefer taking medications? And therefore the outcomes are consistently better when you have good continuity of care. There's this belief that if you take the right vitamin or the right IV drip or eat a lot of superfoods, that must mean you're healthy. When we're talking about health, it's not about one nutrient or one type of calorie. It's about a holistic image of your health. So if you are eating perhaps a diet rich in healthy foods, that's one part of the equation. But if you're then shorting yourself on sleep by getting 4 hours every single night, you're actually going to have negative health outcomes because health is multifactorial. All those things have to happen in combination in order to get good quality outcomes. That's why I frequently say you can't out-exercise a bad diet. On the flip side of the equation, some young people think that they can buy good health by doing unnecessary screenings, blood tests, maybe even peptides or whatever it is on the market. But the reality is, many of these things, if not all, are unproven. So at best, they won't work, and at worst, they'll hurt you. There is actually evidence coming out showing that many of these substances can cause harm. Antioxidants that are used to decrease the risk of inflammation and cancer, when taken in too high of quantities, can actually cause an increased risk of cancer. Again, these are just preliminary studies. But important to know that there is no such thing as a shortcut for good health. Seeing a subspecialist for even the most simple of conditions. Now look, I know fully well as a primary care physician that a cardiologist can treat elevated blood pressure. I know that an ear, nose, and throat surgeon can treat a sore throat. But why would they? They have very busy schedules that are reserved in the ENT's case for surgery and in the cardiologist's case for complex cardiologic conditions. Use primary care to your advantage. We're trained in the most common conditions. We're trained to know when to escalate care to a specialist. Allow us to guide you to give you the best care. In fact, if I had to round up the number of patients I see specifically for high blood pressure alone or sore throats, it's probably going to be higher than the subspecialists themselves. You know, the notion that looking healthy on the outside means you're healthy on the inside is not always true. If you look good on the outside, you could still have terrible mental health. People don't know that's an invisible medical condition. You could look great on the outside, have great numbers on the scale, for example. But then on the other hand, have terrible cholesterol numbers, terrible blood sugar numbers. And when I say terrible, I mean terrible for the potential risks that can then decrease the length of your life, as well as the quality of your life. So instead of assuming just because you look good, that must mean everything is okay. Work with your doctor. Go in for a preventive visit and figure out if truly everything is all optimized. Who wants to live to 100 anyway? I've heard my own nephew say this. Do you understand that logic? The reality is, it's not just about the length of life, which, by the way, becomes more and more important as you age because everyone wants to continue living. And then second of all, it's also about the quality of your life. Yes, it may be true that not even the majority of smokers will get lung cancer, but the huge majority of long-term smokers will develop conditions that will hurt quality of life. And quality of life really means the enjoyment of life. Being able to be independent, being able to go out with your friends, interact with others, have a healthy cognitive state so you could play games or whatever your most favorite hobby is. The majority of young people like Gen Z and millennials reported using urgent care primarily for their health needs. It's not just a pattern I've noticed in my practice. It's happening all across the US. I just explained why relying on urgent care to provide primary care isn't a great idea. Another alarming trend from the survey? Men are less likely to visit the doctor. Fellas, this isn't great news. I know logistically it can be difficult to find time to visit your primary care doc, and it could mean taking time off of work, which is a headache, believe me, I get it. But ignoring a health concern might just be making the problem worse and creating more expensive series of medical visits down the line. Oddly enough, one of the most effective ways to get people to visit the doctor? A gentle nudge from a friend or loved one. Seriously, the survey found that the majority of people not only felt a friendly and loving push convinced them to visit the doctor, but that it resulted in positive health outcomes and they were glad about the recommendation in the first place. We don't need to shame people, but simply reminding your friends and family about the importance of getting things checked goes a really long way. So often I hear that someone's going to work out extra hard so that they can eat whatever they want. Boy, I wish it was that simple. The reality is, you can't out-exercise a bad diet. Take even the amount of calories in a typical fast food meal. It's like 1,100 calories. You need to run at 5 miles an hour for approximately 2 hours to burn off that meal. And that's just that meal. So you gotta think about the fact that you gotta lose more if you wanna be losing weight. And remember, when it comes to junk food, they're designed to be non-satiating, so you wanna eat soon thereafter. And second, they're usually high in calories and not using the best ingredients. So all those things are not great for your health. I had a patient the other day say that cholesterol doesn't even matter for young people. That's not really true. In fact, the initial fatty streak that starts aligning your arteries happens around your first and second decades of life, and that's the beginning part of developing atherosclerosis, aka blockages, in your blood vessels. That's what leads to heart attacks and strokes. And there are individuals who may suffer from genetic conditions that lead their cholesterol to be so sky high that they may have really extensive silent heart disease, leading to having a heart attack early in their lives when it could be totally preventable just by visiting your doctor and getting the right tests. It's been instilled in my patients that if they feel warm, they should reflexively take an anti-fever medication like ibuprofen or acetaminophen. In many cases, if you're a healthy adult, taking fever-reducing medications when you have a mild fever won't be very helpful. In fact, I counsel my patients that a fever actually has beneficial effects on fighting off infections. Back in the day, there was research done about artificially creating fevers for patients in order to battle infections. So perhaps it might be more wise to think about a mild fever, if you're healthy, as your friend. There's a huge spike in those who are going to these IV drip spas and getting all sorts of drips, thinking that it's a miraculous healing potion. It's going to make them feel better sooner. There is no evidence for this, unless you have a rare condition like a malabsorption where you can't get certain nutrients from your GI system, or you're vomiting profusely and you can't hold fluids down. But in most cases, if you feel fine, hydrating through your GI system, aka drinking, is going to do the same thing with maybe a 20-minute delay. No big deal, but doesn't create an artificial opening in your skin. And on top of that, many of these IV drip places, especially targeting hangovers, will put prescription medications like anti-nausea medication in them without even telling you the potential risks of those medications. And the placebo effect is so strong that having a legitimate medical person come and do this procedure will make you feel better just because it's happening. But you don't need to do that. And doing it actually exposes you to more risk than benefit. One of the most common diagnoses that I make on social media, not even in my practice, is Googleitis. People thinking that they know exactly what's wrong with them because they did a Google search. And I'm not anti-people doing a search about their symptoms. In fact, I like when people do that, because patients then come in with better questions. The important thing to avoid in a situation like this is to do the search and assume you have all the answers. Allow a trained medical professional to work with you to get to the bottom of the problem and then lay out all the possible options so you can decide what's best for you or your family. So many are quick to write off needing mental health support as being weak, and that cannot be further from the truth. In fact, going for mental health therapy should be considered as normal and simple as going to physical therapy for a pulled muscle. Every human is prone to cognitive distortions, allowing emotional reasoning to take over their behaviors, their thoughts, their feelings, and then leading them to feel not so great, which can also lead to some physical symptoms as well. A common assumption is that when you make an appointment, you can get all your concerns answered in that appointment. And that's just not feasible because it's not practical. We have a set number of minutes set for the encounter, which is usually too small as it is, and we also want to be respectful of the patient's time that is after you. So we can't address every single issue in a visit. That's why it's important to lay out to the office staff what you like to talk about, and then narrow down specifics as soon as you get in a room with the doctor. And a pro tip, if you have multiple concerns, don't bring all of those concerns for your wellness physical and have them addressed there. Because what ends up happening is that all the preventive stuff we can talk about and put effort into preventing problems kind of get pushed down the aisle. So instead, come in for those acute or chronic problems on separate visits, and then schedule and put all your emphasis on prevention during your physical. There exists this belief that you can get pregnant when you're on your period. And I want to dispel that notion because there are so many situations when that happens, and people are then flabbergasted by their reality. It is true, you can get pregnant every single time you have sexual intercourse, even if you're using protection. Because there is always a possibility of failure. There is no such thing as 100% protection with the exception of abstinence. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.